May is Mental Health Awareness Month, and we're having important conversations about mental health every Monday this month. 1 in 5 Americans will experience mental illness in any given year, and 1 in 5 children struggle with mental health. But finding and paying for mental health care can be challenging and overwhelming. Research shows that only 46% of adults with mental illness received health care for it. Jamie Howard is a senior clinical psychologist from the Child Mind Institute. Jamie, good morning. How are you doing?
Good morning. Good. Thank you.
So there are many different types of mental health care. What are the different types, and then where do you start?
Right. Okay. So the term therapist can be confusing because it refers to a wide array of professionals. So one is a licensed clinical social worker that you might hear of. This is someone who has a master's degree with specialization in providing therapy. Then there's a clinical psychologist like myself, and the letters you might see are PhD or PsyD, and we specialize in providing therapy as well. We also do research and provide testing. And then there's psychiatrists, and they have MDs. They go to medical school, and they usually tend to focus on prescribing medicine. So there's all of these different professionals who can provide mental health care. One of the most important things you want to look for is what we call evidence-based mental health care.
Okay.
So that means that there's research to support the various elements of the therapy that your provider is administering. And one of the most important things is to remember, regardless of what type of mental health care provider you have, you want them to be licensed and credentialed.
Okay, so how do you know as a parent when it's time to seek out professional help?
Right, so there's a few things we want to keep in mind. When you're monitoring your child's mood or behavior, you want to think about the duration. How long has this been going on for?
Okay.
If it's been up to a month or so, that's when we start to think that treatment might be indicated, and you should at least get an evaluation. You also want to consider the intensity. So is this symptom, so for example, you have a very irritable teenager. Is this like any other teenager? Are they just kind of difficult right now? Or is this more significant? You can sort of get a sense by talking to other parents or teachers, pediatrician, to get a sense of that. Then you also want to look at the frequency. If it's happening most days, the mood or behavior problem that you're noticing, then it's also a good indication to get treatment.
Some people may make a call and say, all right, it's time. Whether it's for myself as an adult or my family members, my kids, but then they can be booked up for months at a time.
Right.
So what do you do in that situation?
So one thing we like to recommend is that you start with either your general practitioner or your pediatrician, because sometimes they can actually treat the medical issues underlying a psychological condition. And then if not, they also usually have really good community resources to refer you to. They might sort of have their finger on the pulse of who's available and where's a good place to go. The other thing to keep in mind is telehealth. So it's sort of the silver lining of the pandemic in so many ways, because it's reduced a lot of barriers to care for families, for adults and children alike. So I still do a lot of telehealth in my practice. Even though we're able to meet in person, people just tend to prefer it because you don't have to deal with parking and transportation. It just cuts down on a lot of hassle.
Jamie, you're the best. Thank you so much.
Thank you.
We appreciate you.